Hey guys, just wanted to record this video to say congratulations a little belatedly on completing week 2 assignments, all about health insurance and legal and ethical issues in healthcare. Everyone seemed to fare pretty well on the quizzes, and there were a couple students who did email me about some questions that they needed their grade updated because they had a typo or some other such error in the question. So do feel free to contact me if that happens to you. There was also some trouble uploading pictures from that confidentiality activity that you did online, so some students just emailed them to me, which was fine. There were supposed to be 2 pictures from a pre-test and a post-test, so if you only uploaded one, you only got half credit, but if you email me the missing one, I will be happy to update your grade for you. I especially had fun reading through your forum discussions this week. In the ethics case study about the 2 patients that needed the heart transplant, you guys argued about which candidate deserved the heart more, either the one who was first on the list, Mr. X, or the one who seemed like she would take better care of it, which was Miss Y. But really, to make a truly ethical decision, you can't just divvy out organs to the people who are first in line. And you also can't judge patients for their personal choices. But you do have to take all of these factors into consideration in order to decide which case is most deserving, not as much which person is most deserving. Review boards do have rubrics in order to do this in the most objective way possible, taking into account things like patient history, their overall health, the probability of success of the transplant, and you guys touched on all of those things. And I'm not sure if you guys have any personal experience with transplants or organ donation of any kind. I recently lost, or I have a friend who recently lost her dad to kidney and liver failure, and he was back and forth with transplant review boards because they were trying to get him on the transplant list and could not because he was a little too old or a little too sick or a little not sick enough. So even getting on the list to begin with is an ethics review process, and it's not always fair. It doesn't always seem fair, but these ethics board really are trying to make a decision that will lead to successful transplantation rather than what is also unfair would be getting patients' hopes up at a chance for additional life when really the transplant is not likely to work and would be a wasted organ. So my friend's dad, he died of liver failure, was not actually an alcoholic. But speaking of alcoholics, that was another interesting area of the discussion there. I do wonder if I had used the example instead of alcoholism of like an infectious disease like hepatitis C or HIV or cancer, if your answers would have been different, because oftentimes if a patient has an incurable medical condition, they are not candidates for transplants. So some people consider alcoholism and addiction to be an incurable terminal illness. So if you think of it that way, that might be maybe a less judgmental way to come to a conclusion about transplant patients who are alcoholics. So I just am glad that you guys had some good discussion and some thoughtful points there. And I just wanted to see you, put on your critical thinking caps and see how difficult it can be to make these decisions that can be really hard but have to be made in medicine every day. The other forum was about the Tuskegee experiment. And there were a lot of good analyses there as well, and some that needed some work. I was really happy to see you all engaged and responding to each other's posts. But I realized I didn't give you a lot of direction in how to have substantive responses to one another. So in the future, I'd like to see not comments like, I agree with your point, or, good research there, and complimenting each other or agreeing with each other. Instead, good comments are ones that really kind of do the opposite, to challenge somebody else's comments in a respectful way, or to pose further questions, or to sort of act as devil's advocate and say, well, what if, or imagine if, X, Y, or Z. In fact, someone actually did that a little bit to some extent in the heart transplant case. I think they said, well, imagine if Mr. X was your dad, or imagine if Miss Y was your mom, which just kind of just challenged people to think and open up further discussion. So posing questions or posing alternative viewpoints is actually really the best way to respond to your classmates rather than just saying, I agree, which is not as interesting and doesn't push the discussion along. Anyway, the primary reason that I wanted you to research the Tuskegee experiment was because it was a prime example of unethical medical research without patient consent. And patient consent is a major topic in ethics in healthcare. So before the 1940s, patients of all ethnicities really had very few rights. Someone in the discussion even mentioned the inhumane experimentation that the Nazis performed on concentration camp inmates. And ethical codes for medical research were actually established in 1947 as part of the Nuremberg Code as a direct result of the numerous ethical violations in the Holocaust. So there really are countless numbers of cases that I could have had you explore besides the Tuskegee case, but I really like that one for several reasons. One, it occurred in somewhat recent history, which is kind of scary and makes it, I think, a little more relevant because it's not so long ago. The 1970s was relatively recent. Number two, for such a huge case of ethical violation, it's really relatively not well known, which was evidenced by many of you saying that you had never heard of it before. So I like to expose students to new knowledge when possible, so that's another reason I picked that one. Number three, reason that I chose it was precisely because of the racist nature of the study, since this week in week 3, one of the topics is cultural literacy and understanding different cultural perspectives. So for many African Americans who were growing up in the 60s and 70s and became aware of this study and other similar studies of a racist nature, it resulted in an understandable distrust in doctors and in public health. So knowing about this case can help you relate to people of that ethnicity and that generation. I do want to address some comments that I felt were unintentionally a bit insensitive, and I just wanted to clarify some points on that matter. So number one was that one commenter had suggested that racism was not an issue back then because it was the norm to mistreat African Americans. And I just want to say that just because racism is normal, it doesn't mean that it's not racism. Think about it. Do you really think, or think about this question, do you think that racism is more excusable if everyone does it, or if it's just sort of a more rare occurrence in society? And you could ask the same question of other sort of unethical behaviors, torture, bullying. Are those things acceptable? Are they not wrong just because they're normal and acceptable in society? Mistreatment of, women in other cultures, is that okay because it's normal for their culture? That's sort of an ethical question for you to consider. Number two, while the poor black men in the study were uneducated individuals, there were also poor, uneducated white males that they could have used. So why do you think they were not used? Another question to ponder there. Number three, there was a suggestion that the men should have known that they had syphilis because of their symptoms, which is really just incorrect because there was no WebMD in 1970. People were not as maybe well versed in medical symptomology as lay people are nowadays with the internet at the tip of our fingers. And a lot of people were not aware that they had a medical condition. And especially with syphilis, syphilis has a lot of asymptomatic stages of the disease. So it's particularly uncommon for syphilis to go undiagnosed. But the lies that they were told about their disease state did result in them spreading syphilis to their partners, and even in some cases through their partners to their children. And so then the question is whose fault really is that? Something to think about. And then lastly, while it is true that experiments in science and medicine do need to be done in order to make advancements in those fields, scientists and doctors are not justified in violating human rights or civil rights to do so. As someone said, or several people even mentioned, that humans are not lab rats. We shouldn't be treated like lab rats. That's what lab rats are for. Sorry, ASPCA, but there are some studies where humans are treated, are like guinea pigs in pharmacology studies and drug trials, but now when they are participating in them, they're doing it consensually, being informed of all of the risks that are involved, and sometimes are even compensated for them, as some of you guys mentioned. So here's one last question to leave you with. How do you decide if an experiment or a clinical trial is worth risking the health of human subjects? And also, does compensating them serve as a subtle way to sort of coerce them or pressure them into doing something that could be harmful for their health? Is that ethical? Is it ethical to pay people to put themselves in harm's way? So a lot of questions still coming out of this discussion, so that means it was pretty healthy. All right, so that's the end of the week 2 wrap up, and I think many of you have already started working on week 3. Let me know if you have any questions anytime. See ya.